On the Medical Watch, autism rates are rising dramatically. According to a report by the Health and Human Services Department, autism is an epidemic. The HHS secretary said this morning, in the last 20 years, autism diagnoses have increased by more than 300%. Robert F. Kennedy Jr. held a news conference where he outlined the need for better study and intervention. He made bold claims there is no genetic connection to autism. Kennedy says environmental causes lead otherwise perfectly healthy infants to regress at age 2. Researchers found 1 in every 31 children was diagnosed with autism by age 8 in 2022. That's up from 1 in 36 in 2020.
One of the things that I think that we need to move away from today is this ideology that the autism diagnosis, that the autism prevalence increases, the relentless increases, are simply artifacts of better diagnoses, better recognition, or changing diagnostic criteria. If you look at Table 3 of the ADDM report, it's clear that the rates are real.
You heard Secretary Kennedy. While awareness and better diagnosis, including new diagnostic standards, can increase the number of children identified with autism, Kennedy said that does not account for the huge increase in cases. The report also found boys have consistently higher rates of autism diagnoses than girls. So joining us now to talk about the new findings, Chairman of the Pritzker Department of Psychiatry and Behavioral Health at Ann and Robert H. Lurie Children's Hospital, Dr. John Walkup. Thank you so much for being here. I think we really need some perspective. Of course, increasing awareness and study has to be positive. Secretary Kennedy said he wants such rapid results. Is that feasible?
That's a very good question. I think there's been a lot of study looking at this, and there are a lot of autism experts who have maybe opinions that disagree with the secretary. I think there is some suggestion that genetics does play a role, but I think there also are changes in diagnostic practices. But the thing that wasn't mentioned was changes in services available. So kids who get diagnosed with autism can, as a result of that, have a different variety of educational interventions that would be available to them. And some kids who have work in maybe environments that aren't as rich in resources may find that there would be biases in their system to increase the rate of diagnosis in order to make kids in a better position to be able to access those resources. So it's a variety of factors, I think, that account for this increase.
And I want to talk a little bit about what parents should look for in a moment. But first, Secretary Kennedy hinted at these environmental causes. What might those be?
Well, I think when I think about environment, I think of all those things like increased resources for kids who carry a diagnosis of autism. That's part of the environment too. And as well as the changing kind of understanding of what the autism spectrum is. It's changed a lot from when it was first described in the 1940s, and it is a much broader definition now than it's ever really been. So I think those are things that are all part of the environment, let alone whether there's some particular toxin or some other kind of agent in our environments that explain this rise and increase.
And you hinted at this idea that it's absolutely not genetic is not necessarily the case.
Yeah, I think the people who study this think that there's a strong genetic component to this. I think what you see within families is you see some people talk about the lesser variant in siblings and sometimes the lesser variant, milder forms of the similar characteristics in other family members. And the genetics will be very complicated. And there's probably multiple kind of genetic problems that could occur resulting in similar kind of clinical features. So it's not a simple genetic problem, but it is, I think that it's hard for people who are in the business to kind of say that genetics doesn't play a role.
And since you know that early intervention can help, perhaps the most important question is, what should parents be looking for to get that early diagnosis?
Yeah, there's 3 core components to an autism diagnosis, and the one for me that's the most important is the lack of interpersonal reciprocity. And that's really, do people really understand that back and forth of human interchange? And kids who don't have that, it's oftentimes quite easy to pick up in kids who are really quite young, as young as 12 to 18 months. You can begin to pick that up. Pediatricians are also screening for it early in life now. So, regular pediatric care will put you in a very good position to pick up kids early and to get them screened. I think the biggest issue with screening and early intervention is we can identify the kind of more straightforward cases or classic cases, but the milder cases may take a little bit more time to pick up. And then the other aspect is the availability of services. There's more now than ever before, but we're still nowhere near kind of having a system that's in place that actually can provide services for these kids.
Well, hopefully talking about it like we are now is going to make a difference for so many families. Dr. Walkup, thank you so much. You can find out more at luриechildrens.org, and the full autism study is available at cdc.gov.